Spokane County Health Officer Bob Lutz says there's been a shift in the trend of coronavirus cases. Older adults are at a higher risk for coronavirus, but Lutz says we can't overlook the younger age groups. He says about 41% of recent cases are people between the ages of 20 to 39.
Maybe a misperception on many people's parts is that this emergency has not ended. It's actually picked up pretty significantly.
He says this is likely because people are still not wearing masks and going out for activities in larger groups.
We were on a phone call with a restaurant tavern, and without naming this institution, I now have 21 cases over the course of 2 weekends.
He did say the customers and booths inside were not set up for social distancing.
And so the behaviors are as much sort of propelling our infection rate as anything else that we're dealing with.
He noted there have been 672 new cases since the county moved into phase 2. The latest numbers bring the total number of cases to more than 1,100.
I think time is not on our side. We waited long enough.
The Board of Health also talked about a health equity policy. It would require the health district to closely look at its programs, making sure the same health services are accessible to everyone across the county, regardless of race or financial status. The pandemic has affected Black and Indigenous people at a higher rate than other groups. Councilwoman Betsy Wilkerson said this would make a statement for the district standing against racial inequality.
But don't lose sight of it that you come from a different perspective than Black folks, Indigenous folks, other folks who are not in your shoes.
Following Wilkerson's lead, the board decided to give detailed discussion to this policy at its July board meeting. In Spokane, Shayna Waltower, KREM 2 News.